We're going to continue on with growth and development. I would like you to ensure that you are reading your book and taking your own notes because we are skipping over some of the different types of development because they kind of progress throughout the child and adolescent pediatric time kind of consistently. With spiritual development, the knowledge of faith and religion is learned. It's learned from your parents. And then as development expands, we will see their ideas and knowledge of faith and religion expand as their developmental levels change. When you think of the preschoolers and toddlers, they really only have a vague idea about God and religious teaching. And then with school age children, they understand and have a more concrete concept of God. Adolescents will typically imitate the religious practices of their parents. They have a full understanding of God, of religion, and of the church. Moving on to the concept of developing sexuality. When you think about the pediatric client and you think across the spectrum from infancy to adolescence, it is a gradual progression. During the toddler phase, that's when there's a strong attachment to the opposite sex. So to young boys, they have a very strong attachment to their moms, and girls a strong attachment to their dads. They begin to understand the concept and kind of become concerned with modesty during the child or during the school age, and then also sexual exploration and questions about sex and reproduction continue to rise in strength, and as the child begins to develop and gains more understanding about the differences between the sexes. Language, as the pediatric client ages and develops, there is an increasing level of comprehension. The child learns to understand, and comprehension is greater than the number of words a toddler can say. So they understand the actions that are associated with words and maybe don't necessarily understand the words, but they can understand that some words mean anger, some words mean love, and things like that. And then it talks about how one word and multi-word sentences progress across the spectrum as well. We have talked about how children need to move through the normal stages of growth and development, and these are just a few ideas and a few things that need to be of concern and play an important role when these pediatric clients develop. So we talked about infancy being a time of separation and stranger fear. We do need to educate our parents to have a limit setting and discipline their children. And I'm not saying go out and spank them or slap them or lock them in closets. I'm just saying that you need to set limits so that children begin to understand what is right, what is wrong. Toilet training is going to be of importance during that preschool time. Sibling rivalry is just a natural jealousy and resentment of children to a new child in the family. The arrival of a new infant represents a crisis for even the best prepared toddlers. So we need to encourage patients that are having another child to consider the idea of enrolling their children in sibling classes and things like that. Temper tantrums are really just an indication of the child's inability to control emotions. Toddlers are particularly prone to temper tantrums because they want so badly to have mastery of skills and gain their autonomy, but their lack of fine motor and gross motor and cognitive skills and adults saying no tend to inhibit those responses, and so we see temper tantrums being a way that the child tolerates anger or deals with their anger. Negativism I talked about earlier. It's really a necessary assertion of self-control. We see regression occurring when a pediatric client retreats from their present pattern of functioning to past levels of behavior. We usually see this in response to stress. So when children are hospitalized or are sick, we do tend to see them regress into other types of behaviors. With the toilet training, typically we see that training is a complex psychophysiologic function. We need to recognize that there are certain things the child has to have control over prior to toilet training, and so the child must be able to recognize the urge to let go and hold on. They have to be able to communicate that sensation. There needs to sometimes be a motivation to get them to go, but their motivation is a desire to please the parents. So we do like to see that. Your book talks about 5 markers that signal a child's readiness to toilet train, and that's on page 1025, as well as guidelines for assessing toilet training. And so take a peek at those and become familiar with those. As far as school readiness, there's really no absolute indicator that says, yes, your child's ready to go to school. But they do need to have a degree of social maturity. They have to have some attention span so that they are able to learn and listen. When children are enrolled in schools, it's really important that the parents promote a positive attitude toward learning. It's important that we tell our parents to read to their children, get them active and explore their talents, and introduce them to the school. With school, we also need to pay attention to infection control. So this bottom picture just shows a couple of kids washing their hands, and so we need to educate children about proper infection control, good hand washing techniques, and those types of things. With our school age child, really the only other socializing agent that kids get is their family, so school is going to be really important. And as I've said earlier, peer relationships are going to become more important. If you look on page 1086 of your book, it talks about coping with concerns related to normal growth and development in the school age child. It's important to think about teachers and parents and trying to unify their goals so that we have good reinforcement across the spectrum. Latchkey children are the children that come home to empty homes. Oftentimes mom and dad both work and they come home to an empty home. So we do need to enforce and instill in our children good behavior, not the dishonest behavior, and discuss with them what's going to be appropriate when they are home alone and maybe what's not appropriate, especially as we look into the later childhood years and adolescent years. Fears are addressed across the book as far as each stage of development. If you look at the toddler, those are on page 1052, school age 1098. As we see the increasing violence in society, that does spill over into the school setting. So sometimes that can be an area of fear and distress for children. So the big idea, or the main idea, is that we want to encourage our children to be able to adjust to the different environments. We want to help them cope with stress. So teachers, parents, healthcare providers, we need to offer reassurance to children to let them know they're safe, have an open and honest communication with them, and then also give them ample time to express their feelings so that we understand what their fears and stressors may be. So with stress, some degree of stress is okay, but if it goes on unnoticed, undiagnosed, that's when we're going to be looking for potential complications, because we know that when we are stressed, it affects our immune response, it affects our immune system, it affects how we think, how we cope. So we want to make sure that we are aware of the signs of stress in children, and allow them to express, what these stressors are, to try to help alleviate some of that anxiety. With aggression, the term aggression just refers to attempts to hurt a person or to destroy property. Aggression is different than anger, because anger is just an emotional state. Aggression is the actual physical part. Aggression is influenced by biological, sociological, familial variables. So do be aware that there is a difference between aggression and anger, and know what factors will increase aggressive behavior. With speech problems, really what I want to talk to you about with speech problem is that the best therapy for speech problems is early detection with early intervention. Disfluency is a speech pattern that is a normal characteristic of language development in children ages 2 to 5. We see it affecting boys more frequently than girls. However, that will typically resolve once they enter like childhood and going to school and things like that. When you are talking to children, make sure you allow them time to talk. So if you have a child that stutters or stammers, give them extra time, refrain from correcting or criticizing them, and then really resist that temptation to complete their sentences, and listen attentively when they are talking.